But my mom and my sister really like did an intervention in 2000, January 1st, around 3 a.m., January 1st, when and it was mainly on my drinking because they could see that. But they were worried about me and said, "We'll pay for you to go see this therapist that my sister had been to. Will you do it?" And by that point, I had sort of surrendered. It was my first experience with surrender. And the thing that I surrendered to was dying of my eating disorder and food addiction. And I didn't really have language. Like I knew what bulimia was, and it was kind of like bulimia, but not really because I didn't have all sorts of body image distortions. I didn't want to lose more weight. Um, but I went to see this therapist, Bill Waldner, God bless him, Bill W. He saved my life. Um, and it was my mom and my sister were paying for me to see him a couple times a week. And I was doing that while in medical school. And I had taken a year for research, and I got a research year in a lab with another amazing doctor who sort of was an angel to me during that time. So I was I was out of the hospital. My schedule was a bit more manageable, and I was able to see Bill W. And after like 3 or 4 months of seeing him, I finally shared with him, "Hey, I'm like, I drink a little bit on the train on the way out here before our sessions." And when I got more comfortable with him, I told him what I was doing with food. And I saw his reaction, and I was like, "Oh, that's not good." And he's a trauma specialist and an addictions therapist, and a saint, just a gentle giant. And he saved my life. One of the first things he said to me was, "You need to go to OA and AA." And I said a few expletives back to him and said, "I will never, ever go to those places." Um, but I was like, the pain wasn't going anywhere, you know. And he embodied a peace, a freedom from fear, a love and a gentleness that stayed the same every single time I saw him. And I saw him for 10 years, 12 years. And that was his own recovery. He had been sober, 30 years, some crazy number from alcoholism, and had done his own work. And I started going to some meetings. I left, uh, I left the AA meetings because I was not like those people. I was showing up with how everybody was different than me. Didn't want anybody to know I was a medical student. But the meeting I kept going to was an eating related mutual support group for the sake of anonymity. And um, and those ladies saved my life. Um, I'd never heard the word abstinence applied to food before. People were talking about maybe like consider looking into like what ingredients are in the foods that you're eating. And I thought that sounds extreme and crazy. Um, but something kept me coming to that meeting despite being the youngest person in the room, being a thin person, um, being a medical student, I wasn't focused on the differences in that meeting, but I was drawn to people's freedom from fear and their spirituality. And they weren't talking about like, nobody said like, you have to do this meal plan or you have to follow this meal sheet, or all they were talking about was the spirituality in each of the steps and their own, this is what I did. Nobody ever said this is what I did and that's going to be your truth too. But they did say to me, these steps were designed to help you find your truth, which is deep down inside of you. And experience that as like my recovery fingerprint from God, that's unique to me and very similar to a lot of other people's story and different from other people's. So after about a year of going and still binging and purging and still, showing up to the meeting, whether I'd been up till 2 in the morning binging and purging or not, I found a nutritionist who helped me develop a meal plan that did not have added sugars in it. And once I got into the steps, once I started making some changes with, you know, getting foods that had added sugars in the first, I don't know, 3, 5 ingredients out of my meal plan. I had been staying at my mom's house at that time, and she and my stepfather, God rest his soul, and hers for that matter now, got all of my, alcohol foods out of the house. And they both loved those foods a lot, so it was particularly my stepfather. So it was a big ask. And she cooked dinner for me every night and really helped me like refeed my body. And the last time I binged and purged was April 11th of 2001. And like it says in the 10 step promises, the problem has been removed. I know what to eat. I eat when I'm hungry. I stop when I'm full. My meal plan has all sorts of things in it, but it doesn't include added sugars. Every now and again, I'll have, I don't typically eat any fried foods either. I just don't have the desire, and also don't, you know, why why break what's working? So
Wow.
so yeah, and then I went re-entered like my fourth year of medical school, and that's where you have to decide like what your specialty is. And I was deciding between surgery and psychiatry, and decided psychiatry. Yeah, and thought I was going to be a schizophrenia researcher. But when I started I was still very ashamed of being a person in recovery. Didn't really want anyone to know that. Still also thought I could drink. So my alcohol sobriety date wasn't until August 13th of 2004. But and that was largely when my sponsor said, Kim, I haven't worked with other people who are abstinent in OA who, instead of having like a baked sweet potato for dinner, have 2 glasses of whiskey as their carb. And then I met a doctor in my psychiatry training program who had been a member of a mutual support group for eating concerns, who supported me in being open about that with my other residency classmates, and said that he would share that he was a member of the club too. And that really like opened up, like it was really the first time that I felt like I was one person
Mhm.
and it could be myself, at work and in my recovery life. And that was very healing for me. And that's when I sort of gravitated more towards doing eating disorder and addiction work.